My name is Dr. Alex Redke. I'm a professor at Millersville in the School of Social Work, and I was the lead organizer on the Millersville side for the Positive Change Conference. I organized the committee and arranged all the events.
My name is Eric Kennel. I'm Executive Director here at CompassMark, and one of my roles in the conference was as a member of the planning committee that helped to organize the event.
My name is Amy Sechrist. Here at CompassMark, I'm a certified prevention specialist, and my role in the Positive Change Conference is as the CompassMark liaison.
One of the exciting things about the partnership has been the opportunity to engage students in learning. We had a number of students participating throughout the day in the Positive Change Conference.
Partnerships are a huge part of the conference. We partner with a number of organizations outside Millersville, including within Millersville, all the different departments across campus that had worked with us on this, on the conference, and also just working in addiction recovery in general. I loved the relationships I had with all those folks. They're professionals, they're passionate about what we're doing, they're great team players. It's just so nice to work with a team of people where there's zero conflict and everybody gets along and everyone's sort of moving in the right direction. And so that's great, it's a good team.
CompassMark's mission is to prevent addiction through education, skill building, and community mobilization. So the Positive Change Conference is a great example of our work to educate the community. Partnering with Millersville University has given us an opportunity to provide evidence-based program, best practice education around all of the services that not only we offer as an organization, but that all of our partners in the community also provide.
Anyone who works where addiction is present is a person we would love to have come to this conference. It's a community conference. So we love the fact that our conference is a place to get up to speed and to give them some tools to make their work a little more effective, because it's really hard interacting around addiction. It's tough.
I would say there's probably two elements that are really important for me about Positive Change. I would say the first one is that recovery is possible. Recovery is everywhere. You just might not be aware of those who are in recovery. So that's the first element, right? Positive change. But the other part is, I think, trying to educate the media in terms of the images that are shown. So a lot of times, anytime we talk about addiction or recovery, we show these terrible images of pills or people who have overdosed or needles or powders. So we're really trying to get the media to kind of change that bad habit and to show more positive images, like with people in recovery can have successful, fantastic lives.
We've received tremendously positive evaluations from participants that attend the conference, and it's really an opportunity to highlight all the successes that we're having as a community in addressing addiction and where we need to continue to work, and bringing people together to collaborate on those opportunities and solutions is exciting.
Positive Change is just our homage to hope, despite the fact that our nation's in an addiction crisis. We feel like if enough people learn about what addiction is as a brain disease and as a medical condition, and then if they learn what prevention really is, we feel there's hope in all of that. And that's our goal, to spread information as well as the hope.